evening, everybody. Welcome to Bra Day 2014. I am Lisa Ann Waldock.
My name is Dorothy Wirt.
My name is Denise.
My name is Jasmine.
Mi nombre es Leticia.
My name is Christine Cifuentes. I was diagnosed with breast cancer in September of 2013.
I was diagnosed in December 2013.
I was diagnosed actually when I was 33.
It was almost 2 years ago now.
I was 26 by that time.
I moved here in January of last year, 2013, and in May, I popped positive for BRCA2.
For me, I was sick for a long time before they ever diagnosed what was wrong with me, and I had all kinds of tests.
I have a long history of cancer in my family.
Nobody in my family has cancer. I'm the first one.
So I went to the doctors and I said, something is wrong. And they said, nothing is wrong. We've checked and we've checked and we've checked and we've sent you for mammograms and nothing is wrong.
And he said, well, yeah, I feel something, but I don't think it's something bad.
Dr. Hendricks told me that I had a type of cancer that only a 60-year-old woman would have, not somebody my age.
My concern was my dad. I'm daddy's little girl. So it was like, how do I tell my dad? How do I tell my oldest? My oldest is my rock. She's always been my rock ever since I got divorced from her dad. She's always been I gotta keep going.
So I was told that to prevent getting breast cancer, my best option was to do a bilateral mastectomy.
I had 9 tumors in my right breast.
I told my husband, I want them both off. I want them off now.
I decided doing a bilateral would be the best way to not only save my life, but be a continual part of my children.
When we found the lump on the left, Dr. Rivera said, we have to do the double. There's no way around it.
So I called Nurse Pat, who was my case manager, and she said, I'm gonna send you to the best in town.
Then they sent me with Dr. Paladino. And I remember the first time he came into the office, I was very nervous.
So I was like in big denial of, no, I can't get it done. I can't get it done. So my daughter's like, yes, you can. You can get it done.
They had given me this list of people to go see, and Dr. Palladino was on that list, and I went and talked with him, and I knew from the time he walked in to welcome me to his office that he was the surgeon that best suited me.
I come and see Dr. Agullo, wonderful man, wonderful staff.
He explained everything, the procedure and everything, and I was more calm.
He has just been so compassionate and caring through the most difficult time in my life because this is scary stuff. Part of me wanted to say, why do I need this? I'm not even going to be alive in a month. In a year. Who cares about breasts? You know, who cares about all of this?
Reconstruction isn't for everybody. Different types of reconstruction isn't for everybody. I'm thankful to God that I found it because I feel better about me. He makes me feel whole again, and I feel comfortable with myself.
You can tell today that one thing brought us all together in this room today, but you can tell that every one of you is very different and unique, and your paths somehow crossed with ours.
So we want to thank you for putting your trust in us, for allowing us to be part of this very important thing that allows you to feel better and allows us to feel better at the same time.
We feel blessed to be part of that path and that renewal.
If it wasn't for my kids, I wouldn't be here.
It was moving very aggressive, and if it wasn't for my husband, I wouldn't have gone to the doctor.
To my husband, who has just been wonderful through all of this, and we have 6 kids.
Between the doctors and their spouses and the staff, they made me cry the last event they had because they said I was family. And if you don't know it, they really feel that way about all of you.
I've been through crying and through doing this and doing that, but I keep myself up because if I go down, there's no other way to go around all this.
We've all got our different stories. Go out and tell your stories. Tell your story. Find every man, woman, and child.
It was a very difficult decision. And now when I look at my kids and I see my son about to graduate college, and I see my daughter serving our country in the Army, and I see my 14-year-old telling us that he wants to be a nuclear chemist and come up with new things to help people like me.
That tells me I made the right decision for my children and me.
I look back and I don't think I would trade that year for anything. My life has been so enriched with great friends, enriched with great family, enriched with great doctors. That's life-changing. That I will be forever grateful for that.